When a patient tells me they can't walk around the block or play with their grandkids, I know it's time for a different conversation. Total knee replacement isn't about being old, it's about getting your life back. So how do you know when it's time? Let's walk through it together. I'm Tyler Goldberg, orthopedic surgeon specializing in concierge hip and knee replacement, and for the last 25 years and 12,000 surgeries, I've seen patients literally transform physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. Whether you're an executive on the move or someone who puts this off for years, my goal is clarity. I'll show you how I guide patients through this life-changing decision. And it really all boils down to this one question: do I really need surgery? That's what patients ask. If you're exploring options, hit the subscribe. We break it all down every week so you can move forward with confidence. Let me be clear, arthritis isn't just a terminal illness. You don't need a knee replacement. But if joint pain is stopping you from living, especially if it's affecting your sleep, your steps, or your smile, it may be time to consider surgery. The goal is quality of life, not just survival. And that is the most important thing. How do you feel? When you come to the doctor, it all starts with just a simple conversation. We call it a history and physical, but at the end of the day, it's just the who, what, when, where, and how conversation. And that conversation is enough for most doctors and surgeons and patients to know what to do. After we examine your knee, we still usually shoot x-rays. X-rays will show findings that are consistent with arthritis. These include loss of joint space, bone spurs, and cyst formation. However, let me be very clear. I have never, to this day, operated on an x-ray. I'm always operating on the patient behind the x-ray. I've seen some x-rays that show severe end-stage bone-on-bone arthritis, and the patient has absolutely zero pain and no compromise to their function. Some patients have very little arthritis on x-ray, but yet they are in severe, dire pain and can't do anything in their daily activity. The first patient obviously does not need a knee replacement, and the second can't have a knee replacement quick enough. Bottom line, x-rays help, but they never indicate a patient for surgery. There are many conservative options that a patient can pursue prior to needing a knee surgery. These would include medications like acetaminophen and anti-inflammatories. Physical therapy, weight loss, and even injections will help many patients delay a future surgery for sometimes years and even decades. Eventually, patients will not respond to those conservative treatments and their knee dictates their life. I usually look for 3 things when it's time to have the talk. Number 1, pain every day that prevents you from doing the things you want to do. This includes simply walking around the block, playing with your grandchildren, or even doing pickleball. Number 2, pain at night that prevents or wakes you from sleep. It is well known that when people lose sleep, they start to look for doctors. And finally, number 3, when you have done everything else in the conservative world and you say, enough, I'm ready to be fixed, then it's time. And here's the deal. In 25 years of doing this, I've never had to talk a patient into surgery. It's your journey and you will know when it's time. So what kind of person are you? Are you the type of person that when faced with knee replacement just says, I want to get this done and over and get on with my life? Or are you the type of person that says, the last thing I want to do is have an operation? That's why the journey is so unique to every individual person. Bottom line, you'll know when it's time. And if you're still on the fence, don't worry, you're in the right place. Every week, we release new videos to help you gain answers, clarity, and confidence that you'll need around a hip or knee replacement surgery. Whether you're just starting your journey or ready for the next steps, we're here to guide you every single step of the way. I'll see you in the next video.